Hi everyone, I'm Ying Yao from Dental Designs, and today I'll be presenting a clinical case of a patient presenting with a toothache. Right? So let's jump straight to the clinical photo here. So this particular patient came in with a chief complaint of a spontaneous pain from her upper right back tooth. So she reported that this particular tooth had previously undergone or attempted root canal treatment, but she was told that from her previous dentist that the root canal treatment wasn't completed because not all the canals within the tooth could be located, right? And a temporary filling material was placed onto the tooth. So when she came in, she complained of spontaneous pain from the tooth, affecting her sleep, affecting her chewing, right? So this is what it looked like intraorally. So as you can see from the arrow here, the particular tooth that the patient was complaining that was giving her pain was on her upper right, the last tooth on the upper right. So right off the bat, as you can see from the photo here, this particular tooth doesn't look the best, right? And why do I say that? Is because you can see there's a very big, very large filling material on the surface of the tooth. And the tooth also appears to be rather short, and there doesn't seem to be a lot of actual tooth structures remaining on the tooth. Right. The next step is we took one X-ray to better see what may be going on in the root canals of the tooth. So this is the X-ray that we took, and the arrow pointing here, the tooth in question is the leftmost tooth here on the X-ray. So as you can see from the picture here, there appears to be a root canal infection that has spread to the end of the tooth, right? And there appears also to be this whitish structure within the canal or the pulp chamber of the tooth. Okay, so when a patient comes in complaining of a toothache, the first priority obviously is to try to help the patient to relieve their pain, to just make them a bit more comfortable. So, and how we do that, firstly, we have to actually identify what is the cause of the pain. So for this particular patient, the cause of the pain would be because of a root canal infection of her upper right second molar. And this was due to uncompleted previous attempt at a root canal treatment, right? So now we move on to the next step would be to what are the methods to help her to relieve the pain. So essentially for this case, it boils down to two main ways, right? So one way is to attempt to complete the root canal treatment. And by doing so, you are reducing the extent of the bacterial infection within the tooth, which will help to relieve the pain. The other option would be an extraction. So the third step is before we decide on what treatment we may want to go about doing is to consider the long-term plan for the patient, right? So let's say if the patient is keen to try to do a root canal treatment, we have to consider that generally after a root canal treatment for molars, a crown will be required to protect the tooth. Whereas if the patient chooses an extraction, we have to consider whether or not the patient would rather choose to leave the missing tooth alone in the future or consider some form of space replacement, such as an implant, right? So for this particular case, what was running through my mind when I discussed these options with the patient is that if she were to try to keep the tooth by doing a root canal treatment, one thing we have to consider is whether this tooth is even a good candidate to be saved. And this is what we call like the restorability of the tooth. And essentially how we assess it is firstly we have to see how much remaining tooth structure, how much healthy tooth structure is remaining for the tooth. Because to do a well-fitting, long-lasting crown, you have to have enough remaining sound tooth structure. So for this particular patient here, as you can see from the first photo we took, there isn't a lot of remaining tooth structure. So the bulk of the tooth is essentially just a filling material with just a thin wall of sound tooth structure remaining. Right. So another thing we have to consider is that this tooth appears very short, so there isn't enough tooth height. So essentially, if this patient is keen to try to explore the option of keeping the tooth, after the root canal treatment, in order to do the crown, she might have to do some more invasive, more extensive procedures such as a gum surgery to better to better to help to facilitate a more well-fitting crown. So it's not the most straightforward, and even then, how long the tooth can last is questionable. So, right. So another thing we have to consider is also the position of the tooth in the arch and in relation to her bite. So as you can see, this particular tooth is a bit of is tilted outwards to the left slightly. So when she bites down, this tooth is what we call in a scissors bite. So it's not in a very normal biting relationship with the tooth on the bottom. So that also makes it a bit more challenging in terms of we want to consider whether or not it's feasible to replace the tooth or keep the tooth long term, right? So after further discussion and explaining the pros and cons of each treatment option and possible associated costs, I think the patient decided on an extraction, which we managed to do successfully for her, and which helped her to relieve her pain and discomfort, which I think at the end of the day is my priority, right? Okay, Ken. So otherwise, yeah. So hope that was helpful, and I'll see you guys next time. Thank you.